Treatment options for psoriatic arthritis. Hi everyone, my name is Dr. Erin Carter. I'm a rheumatologist and I did a video talking about the signs and symptoms of psoriatic arthritis recently, and many of you requested a video on treatment, so here it is. So first, let's talk about lifestyle changes that can be helpful for psoriasis and psoriatic arthritis. First, starting with diet. Now, there's not a ton of good research and big studies on diet when it comes to psoriatic arthritis, but in terms of the studies that have been done, most of the evidence kind of points towards a Mediterranean style or anti-inflammatory style diet. So a diet that's high in fish, leafy greens, vegetables, nuts, seeds, and really trying to also reduce and either totally cut out refined foods, alcohol, processed foods. There's also some studies showing that for certain people going dairy-free can be helpful, and there's also some studies showing that for some people going gluten-free can be helpful. So I will say that in my personal experience, dietary changes are very individual, person to person, and what works well for one person doesn't work as well for someone else. And so it does sometimes take a little bit of trial and error to find what works for you. The other thing that's important dietary-wise is trying to really reduce sugar intake, especially, the really processed sugars like fructose, corn syrup, those types of things. And then let's talk about some supplements that have been shown to be helpful. So when it comes to the joint symptoms, turmeric or curcumin has been shown to be helpful for some patients. Fish oil is another supplement that has been shown in some studies to be helpful for some patients. And then when it comes to psoriasis, so the skin involvement, there's also been studies showing that certain vitamins and supplements can be helpful for that as well. So probiotics and prebiotics, as well as certain antioxidants. So vitamin C, vitamin A, vitamin D, vitamin E, as well as selenium, as well as different B vitamins. Now, I will just caution you when it comes to some of the fat-soluble vitamins like A, D, E, and K, it is possible to take too much of those and get toxic. So please just discuss with your own doctor in terms of dosing if you do want to try them, and don't go over what's recommended on the supplement bottle. Exercise is also important for patients with arthritis. Now, what types of exercise and how much exercise you can do will really depend on how your joints are currently doing. And so I don't want to make any specific recommendations here, but really listen to your body and do what your body can. You don't want to push things too hard if you're in the middle of a flare, for example. But our goal, at least my goal for my patients, is to get you to be able to do whatever exercise you want. Because joints that don't move fuse, and having increased muscle strength around the joints is also very helpful, can help prevent things like osteoarthritis over time, and is really just helpful for bone density and overall health as well. Okay, so those are some basic lifestyle kind of food and supplement changes. Now let's get into medications, because I know this is what most of you wanted to talk about. So first are the DMARDs that we can use. So those are methotrexate and sulfasalazine.